question is, what is our intended impact within the health industry?
Yeah, if we think about CIVA's ecosystem building and how it relates to health, framing in my head, I think about our work with some of the institutions up in New England. And one of the primary things we got out of the earlier days was the first part, just identifying how those different stakeholders relay and engage back, one with each other, and then back to the government. Like I remember one of the key things we were able to find out from our earlier work was that it's broken down into a few different stakeholder groups like academic and research institutions, healthcare providers and networks, government and public health organizations, community and patient advocacy groups, technology and data partners, education institutions and training programs, funding and support organizations, that's like their foundations, industry partners are, other stakeholders that are adjacent, and then people like us or companies like us, startups. And what was happening is that these different groups worked in silos and sometimes partner with each other, but oftentimes had no awareness of each other. And their engagement together is able to not only share data and learnings, but resources to push each individual's mission forward. And then with that, they're able to report back to government agencies like NIH, HHS, CDC to highlight the great work that they're doing and validate, benefit to different community groups, which is where I see our benefit coming in to those organizations. What are you thinking?
I think it's interesting that we do have value in this space, because I know just when we built it, we didn't necessarily intend on going into kind of the health sector, but just after really knowing and learning the needs from those different stakeholders, whether it's from the academics, the high-level researchers, the community health workers, and just the general citizen, and how critical it is to increase and improve public health just through connecting the people that are part of, specific ecosystems. So with our ability to have multiple groups on one platform, really connecting and communicating over information that's beneficial to all parties involved, I think is something special that we end up kind of discovering and finding synergy with. And I think the more impact that we can have in a specific space, the more that we can increase public health outcomes.
I did, before we switch over, wanted to bring it down to another level. So we talked about high level, where it's like these different organizational stakeholders that are usually government funded or some form of private or public, grant foundation funded type of organizations. But then there's also the question that we get from those organizations and why they should join our platform. Like, what's the benefit to the user? Because without the people engagement, even their interaction is still meaningless when it reports back up to the government. And that's where we're able to see great things, which is not only a surprise to me, but I'm thinking what would be a surprise to most people is that I had to correct myself, make it politically correct, but there are a lot of resources that are available to different individuals. Like we always talk about the reduced healthcare that came in from federal government, but the different programs, whether it be screenings or testings or allergy kits or medication or vaccinations or, services for children or disability people, where you can tap into that are not only part of the sometimes research offering by these different organizations or research institutions or groups or, just benefits to the community that people are sometimes left untapped. So that's why people would want to engage, because the government spends a lot of money on ensuring that we're able to take care of our citizens for the most part. And we talked though in an earlier video about how things are layered, and we can help de-layer that so people can easily find resources that may both benefit them. So I think that's important. Not only the government side or the higher agency side, people get a real benefit in being able to connect with these organizations, because sometimes they find access to different benefits they wouldn't have otherwise.
No, definitely.